The first presumptive case of coronavirus has been detected in Toronto, with officials saying it wouldn't be unexpected to have more cases going forward. Though the risk of spreading the virus from one person to another here at home remains low, it hasn't stopped all the worries and concerns. And for one group, they fear they could once again be the targets of racism and discrimination.
As Chinese Canadian, we have had a very negative experience during SARS.
It was during those years that members of the Chinese Canadian community say they were the target of the hysteria that unfolded following the outbreak. And now there are fears that history is repeating itself.
People were not going to Chinese restaurants. People were not going to shopping malls. In fact, me coughing right now in the TTC, Chinese women coughing right away. I'm sure the whole section will clear out. I remember there was so much fear. Once there is a confirmed case in Canada, immediately, because of racism, because of discrimination, the whole Chinese Canadian community will be branded as potential carrier of this virus.
Just recently, a petition titled "Stop the Potential Spreading of Coronavirus in York Region Schools" began circulating, with over 3,400 signatures posted by parents calling on the school board to take, quote, extra actions on this fast spread disease. Among the 4 calls to action, to allow kids to wear masks and that the school board asks students and their families who traveled back from China to report to the school and classroom teacher. It's these reactions that the Chinese Canadian National Council for Social Justice says can lead to students being unfairly targeted.
Not only are we, in fact, being racist, overtly racist, at the same time, it would actually make it worse in terms of public health for all.
Whenever there's an outbreak of illness, there always is a potential for public panic.
Dr. Brett Belchet's a Toronto emergency room physician who trained during the SARS outbreak, says at this point, there's very little to worry about.
As much as we're very concerned about coronavirus, the number of people that are dying from flu is actually far greater in any given season than anything we're seeing from coronavirus. So one of the important things for flu is that you do get treatment quickly.
And how effective are the face masks?
So I see a lot of people wearing the common variety surgical masks that you would see a surgeon wear while they're operating. That will not protect you at all. So those masks are porous. Things that you breathe in will still infect you. The main reason for those kinds of masks are actually to stop you from infecting others.
Is there a conversation that parents should have with their kids? I mean, not only because of the coronavirus, but also it's flu season.
Any child with a fever or symptoms should not be being admitted to class. So that's the most important thing. They should be proactively screening kids for symptoms of cough, fever.
At an event earlier today, Premier Doug Ford said the ministry is on full alert and all resources have been deployed, adding that updates will be provided regularly.
We're going to be monitoring and checking people that are on the plane on the flight back.
There was supposed to be a reunion event today for Canadian alumni of Wuhan University, but that has since been canceled, with the president telling CityNews attendees expressed concern following news that there has been a confirmed case.